I'd like to introduce you to Naomi. Now, Naomi is a 16-year-old girl who is extremely self-conscious about her smile. This is how she arrived at our practice. In fact, this was how she always was. She never smiled. In fact, she was so embarrassed. You know, as awkward as teenagers can be, you know, Naomi was embarrassed about her smile, and that made her quite restrictive in being herself. So this is how she always was. She never ever smiled. It was hard to crack a smile with her. So when we first got her to smile, this is what she showed. Basically, she had she had gaps between her teeth, and her teeth were also flared out at a certain angle. She was very embarrassed by it, and this is a close-up of her teeth. She had beautiful teeth, you know, very good condition, all perfect, but you know, just a slight proclination of her incisors, and basically this was caused by an old habit that she has with a tongue thrust. You know, when she swallows, she pushes her tongue in between those gaps to actually make them even larger. So anyway, we addressed the muscular issues. We taught her how to swallow properly without the tongue thrusting, because basically if we correct the teeth and the tongue thrust continues to be active, then you'll find that there will be a relapse. So anyway, we've had to address that as well. But we used Invisalign because, number one, she didn't want to wear braces and have ugly wires showing, and you know, she was going to school socials, and she wanted to look good all the time. So what better way than to straighten her teeth and no one would know that she's doing it. So basically you can see here from this view all the gaps between her teeth, and really her teeth were fairly straight already, so it was actually a very easy job. We just had to pull the teeth back, make them more upright, make them straighter, and close all those gaps. On the bottom as well, she had some gaps in certain areas that used to catch food, so we also managed to close all of that up. And there's Naomi's smile. And you can see the angulation on her front teeth. They were really sticking out forward a little bit. And this is her at the end. Now you can see here, on the sides here, we've got these little buttons bonded on. Those buttons are there to actually allow the Invisalign trays to actually grab onto the teeth a little bit better, to rotate them, to move them. Now those buttons we bond on, but at the end of the treatment we take them off. So this is now still with the buttons on there, and this is with them taken off, and this is her final smile. You can see her teeth are nice and straight, all the gaps are closed, and we actually managed to finish this in about 9 months. And there she is with a beautiful new straight smile. She smiles all the time now, and it's great for a young girl to be able to do that without being embarrassed. And there's all the gaps closed, and there's Naomi.